Hi, now let's discuss about nuclear medicine imaging, especially PET. So, principle of positron emission tomography. So that is using gamma photons passing through the body and can be measured by a gamma detecting device that encircles the subject's body, or it could be head. And these PET scanner will be a size of similar to our human, because our human body has to be inside a bore. And then the gamma photons, which is generated, will have exactly the same, the opposite direction, and can be detected by these scintillating detectors. And so we want to detect the tiny time difference between, so that we can have, if it's exactly the same, it's in the middle. If it's on the a little bit side, the detection time will be shorter, longer here, shorter here, and longer here. And that tiny time difference gives on this line where were the location of the original emission. So that is about actually a few nanosecond time difference. And remember, we are using eventually AD converter and electronics to find out the difference. So electronics can measure as short as a nanosecond, and it happens to be pretty good for using electronics to use it for PET detection. So I'll give you just a rough ballpark figure here. The delta T time difference will be the distance divided the velocity. And in this case, gamma photons pass through the space almost in speed of the light. And the distance will be on the order of a meter scale at the largest. So that if you quickly calculate 1 meter divided by 3 times 10 to the 8 meter per second, which is speed of light, and you result in a few nanoseconds, which is allowed by our fast electronics to detect. So gamma photon or gamma radiation, or we call gamma ray, is ionizing radiation, which is produced from gamma decay, and it has wavelength of less than 10 picometer, and in terms of energy, a few hundred kilo electron volts. So I want to discuss about the imaging method of PET. So first, detector side. So PET uses a detector using the PMT photomultiplier tube, which detects very fast and sensitively the photons coming up. However, it starts with the nuclear medicine, starts with a gamma ray. So we need to have converting gamma ray into a photons. That we call scintillator crystals. So this 1 unit of PMT and scintillator is a detector block. And for the principle of PET, we do need a circling many number of these detector blocks. So you can see here, not only 1 rim, but it could be multiple rims to detect like 3-dimensional structure. And that you can imagine it costs a lot, because there are many PMTs, which is very costly. And here is the diagram of how this PMT works. And we already discussed high energy photons such as gamma rays in. And in front, there's a scintillator crystal, which will convert this high energy gamma ray into a photon or fluorescence. And that photons will hit a photocathode, which based on photoelectric effect, it will generate primary electron, and that could be accelerated to dynodes and diodes for secondary emission of electron. So huge amplification of electrons, such as 10 to the 5th to 10 to the 8th times of electron generate a current, and you can detect it. And that is the photomultiplier tube with this scintillator. So that's how the detector part of the positron emission tomography, how we image with PET or positron emission tomography. We are using very short-lived radioisotope that emits particles are called, yes, as the name says, positrons. Okay, so so that looks like this. So this is a from the radioisotope of positrons, which is denoted as a E plus because the charge is the same as electron, but it's positive. And that comes out and it hits inside the tissue with the first electron to annihilate. Then that will generate 2 photons with that energy with the 2 gamma rays, which is opposite direction. And that gamma ray can be detected here and here, and we need to compare the coincidence time difference so that we can determine the location of this annihilation happens. So, by the way, we can see the start of this positron starting out and versus by the time it hits this electron for annihilation, there's usually about a millimeter difference. So that's why in PET, even if we do a very good job, the resolution cannot be better than a millimeter. So typically that then makes this PET limits the resolution of the PET. And the positron is an antimatter counterpart of an electron. And when in contact with an electron and annihilation occurs, then that results in a pair of gamma photons in opposite direction. The reason is to preserving momentum. And for this very short-lived radioisotope for PET, we are using, we need a cyclotron, which is a type of particle accelerator to produce short-lived compounds. For example, C11, carbon, nitrogen 13, and F18. And these have pretty relatively short lives. So that's why PET is a device which also needs, at least in the same city or in a near place, a cyclotron. So what is cyclotron? This is just for reference to give you an idea where the name comes from. And you will see it's an apparatus which charges the atom and subatomic particles are accelerated by alternating electric field and it in a circular path. That's why it's called cyclotron. And in nuclear medicine, over the world, in many big hospitals which has a nuclear medicine department, will have likely to have cyclotron to produce this radionuclide. So this is a diagram that inside here, charged particle starts, and these 2 electrodes will alternate generating electric field to accelerate the particle from here to here. It gains its kinetic energy. That's why it gets a bigger radius. And then eventually it is accelerate and fast enough to target and producing a radionuclides. So thin aluminum foil window. All right, and for this, we need a huge magnetic coil up and down. So now I want to change a little bit of this imaging in a practical aspect. So for applications, so we want to measure the heart dysfunction, especially if there's a myocardial infarction. I want to find out if there's any lesion which is under-perfused area of the heart. The problem of the heart is our heart, it beats all the time, and imaging this beating heart is very challenging. So we need to devise a smart ways of knowing the heart beating. Then this beating heart is dynamic. So we developed ways to take picture. It's very short, but it's a snapshot of each of different phases of the heart. The thing, it's dynamic. The thing is, it is a periodic. So that's what we call as a gating. And we can use our technique called ECG to exactly know the status of the heart beating. So this is a diagram that we use ECG, then we can see the periodic motion of the heart, and we can divide this heart into a number. In this case, maybe 8 times of time interval. Then we take picture at this phase. But we do know about from the ECG each of these repeating times. So each picture may not have high signal, but we can accumulate this, let's say R1, R2, R3. When there's a QRS complex will indicate the same phase, we just add them up and we have a higher signal, and we are using this to a snapshot of this status and the second one, and so likewise. So it combines those gated images. So that we call this technique as cardiac gating. It's an image process can be synthesized with the patient's own heart rhythm by using ECG to prevent blurring. Because if we expose all this time, the heart is moving and it will be very blurry. So this is a very smart algorithm to be used for both SPECT and PET, and information about the organ size. Now we have a good resolution, relatively, shape, position, and irregularities can be detected. So for example, liver abnormalities or abscesses or lesions, we can find a hepatitis or cirrhosis. Okay, if there's an enlarged spleen or splenomegaly, then we can see that indicates an infection. Or brain, we can measure blood flow or metabolism, and even neurotransmitter binding, which is a functional imaging. So with this development, in fact, this technology or idea can be also used for another area. For example, optical imaging. Using optical endoscopy to image the heart is very challenging for the same reason. So we borrow the idea from here for endoscopy of the heart if there's an animal. So it's a tiny, tiny heart, but it's a beating heart. Then an animal is also breathing as well. So all this one, we can use that idea into intravital microscopy. So here I have an example that the animal has on a ventilator, so we can control the breathing rate, and the lung airway pressure gives a relatively flat part. We can use it for imaging. Here, inspirational gating window, and at the same time, the heartbeat itself. So there's a PQRS, T interval, and you can find out the relatively stationary part of the heart beating, so that it allows us for imaging. So that we call cardiac gating window. And both of this inspiration and cardiac gating meet that segment of gating window, which allows us to a stable stationary imaging. And over time, we can accumulate for high signal to noise ratio imaging. So that was published in 2011 in Nature Methods. So you see, one part of the nice trick or technique can be used for another part. So now I give you another example. The problem of PET is it has an extremely high sensitivity and specificity, while it does provide a little poorer anatomical structure. So that's why PET can be combined with another more structural image such as CT or MR, and that gives us a better view of what's going on in the body. So here I put some examples of MRI and the PET imaging. We can combine them together so that on overlaying under the structural anatomy, we can overlay the metabolic activity. So for example, a thyroid image is a first routine clinical application by use of the property of iodine which accumulate in the thyroid. So we use 131 iodine to detect the thyroid cancer and to evaluate whether there's over or underactive thyroid activity. And heart and brain as well, because they are always very, very high metabolic activity. So location of damage caused by, in the heart case, heart attack, or stroke for the brain, it can be imaged by using PET and maybe MR together. And bone scan is also another good example. Bone growth, fracture, and tumor in the bone and infection can be visualized because that metabolic activity is increased, which means inside the bone there could be a tumor growth or there's a fracture. While on the other hand, if that particular area of the bone has shown decreased activity, that may be meaning that location of damage or restriction of blood flow. Okay. So, positron emission tomography, what are the pros and cons or merits and limitations? So pros is in imaging, yes, metabolism of specific bioactive molecules such as a neurotransmitter. We can, for example, we can study relative metabolism of serotonin in human brain by use of radioactive ligand that binds to serotonin receptors. Then we can measure those relative metabolism. On the other hand, the limitation of PET compared with, let's say, another functional imaging modality such as functional MRI, which we will discuss next time, is it may have the same temporal resolution, but it has a low spatial resolution of several millimeters. And PET, the problem is it doesn't provide anatomical data, so that we often combine PET with a CT or MRI for overlaying anatomic information as well. However, PET has a pretty high cost due to use of radioactive isotope, and the most of the PET isotopes must be synthesized on-site using cyclotron device, which itself is a big, expensive equipment. And the reason is it's a short-lived isotope, so the half-life is usually very short. And on the other, for example, popular PET radioisotope is called glucose analog, which is called F18 FDG fluoride. The glucose, it has a half-life of about over 2 hours. So that is required to inject into the subject before taking image. So remember, for example, our institute has a micro PET, but we don't have a cyclotron. In that case, we have a little limited use of micro PET because in the local hospital, there's cyclotron. We actually order it. There's a quick service delivering it within several tens of minutes. Then we have a only limited time interval to image for run the PET. So that is a kind of a limitation. But however, it gives a great metabolic information. So in comparison with the PET, I want to go back to SPECT because it's a cheaper alternative to PET. And in the United States alone, almost 75% of nuclear medicine imaging is done by SPECT, not the PET, because PET's more expensive. So a SPECT, I'll give you one example of heart imaging under stress and rest condition, and technetium-99 base of SPECT and F18 base of PET. You can see the image quality different. So similarities, both are functional images. It can measure in the brain, for example, neural activity. And both do not give a very good structural data. And radioactive probe is injected or inhaled into the circulatory system, and that the probe has to bind to, for example, red blood cell to be carried through our body, for especially for blood flow case, detecting increased neural metabolism from radioactive signals. And both, not both, SPECT uses a detector with a, yes, gamma camera. So here I have a little bit of a table comparison. SPECT emits gamma radiation, while PET, that radioisotope, emits positron first, and then that converts into the opposing pair of a gamma rays. And in terms of resolution, PET has a little higher resolution, and SPECT uses long-lived radioisotope, which can be cheaply manufactured or made, while PET case, we have limited half-life of radiopharmaceuticals. So difference of PET is not as, the SPECT is not as costly by using cheaper radioisotope that do not require on-site cyclotron, because cyclotron is a big equipment. So SPECT detects immediate gamma rays using gamma camera directly. So that's why it's a single photon emission CT, because it's one single gamma ray. While PET traces emit what? Positrons, which after annihilation with an electron inside tissue, that result in two opposing gamma rays, which energy in fact is about 511 kilo electron volt each. So this is an example of SPECT. Okay, next time we'll discuss about magnetic resonance imaging. Thank you for your attention.